Hi, my name is Brianna. I'm going to be your student nurse today.
Hi, Brianna.
How are you?
Good.
Good. Can I have the SFAR report on the patient in room 620?
Yeah, 620. Okay, his name is Ryder Kind. He's 67 years old. He has no known allergies. He's full code. He's on an 1,800 calorie diet and a 2-gram sodium restriction. And his physician is Dr. Phillips. He was admitted yesterday. All right, so Mr. Kind comes to us with a stage 2 diabetic ulcer on his right heel. He's a type 1 diabetic. He's a medium fall risk, and he's at risk for pressure sores. His weight has been consistently 170 pounds. The current medicine that he's on is simvastatin to lower his cholesterol and lipids, gabapentin, which is for his neuropathy, which I'm assuming is why the ulcer kind of got out of control because he doesn't have the feeling in his feet. He's on insulin Humulin 50/50, so 50 NPH 50 regular, and then what we're going to give him today is regular insulin, Humulin R, that has a peak time of 2 to 5 hours, so that'll come into play when we want to check his blood glucose. For PRN, he's on morphine sulfate, and that is would be administered IV from his right forearm, and his last pain was a 1, so we won't need to administer that today. A little bit about his background. His heart rate 76, respiratory rate 16, O2 was 96, blood pressure 128/70, and that's actually low compared to his baseline. When he came in, it was 145/72 and 140/72. So we want to kind of keep an eye on that as well. And like I said before, his pain 10 minutes ago was at a 1. Some important lab results. His last blood glucose about 10 minutes ago was at 290. His current AC is 6.5. 3 months ago, it was 5.2%. So that shows in the last 3 months he's kind of let up on his diabetic diet and his glucose control. His fasting blood glucose was 310 when he was admitted. His total calcium was 7.4, which is a little bit low, but because he's an older man, we would expect the levels to fall a little bit lower. His potassium is 3.8. It's within the range of 3.5 to 5, so it's acceptable, but we want to keep an eye on it because it is a little low, and insulin is just going to make that lower. So when he came in, he said that his blood sugar has been in the 300s for the past couple weeks. Before that, he was able to keep it below 120. In his head-to-toe assessment, all of his systems were unremarkable except that ulcer in his right heel, and he said that he has the neuropathy in his feet, so we want to keep an eye on that. His current blood glucose, again, is 290, which is why we're going to go in there and give him the regular insulin. So I recommend that we turn the patient since he's a pressure ulcer risk. He would like information on the diabetic diet, so we'll give that to him. I'm also going to recommend that he exercise and teach proper foot care. It said in his reports that he was soaking his feet in hot water and salt, and so we want to obviously not have him do that. Yeah, so that's basically it for the SFAR.
Okay, thank you. So why specifically is the client receiving regular insulin?
So he's on insulin because he's a type 1 diabetic. His body isn't producing insulin, and this is going to lower his blood sugar. It was 290, so we want to bring that down.
Okay, so what action does this medication have on the body?
So insulin is going to increase glucose uptake by the cells, and it's also going to decrease glucose production by the liver.
Okay, so when should you question administering it?
We are going to question this if his blood glucose is below 70 because it's low. We don't want to get it any lower. We want to keep it between like 60 and 100, so we don't want to lower it. Or if it is above 300, we are given instructions to call the health care provider. And then also if he's refusing to eat, we don't want to administer the insulin.
Is there a therapeutic serum level?
Not really for the insulin. We just want to keep the levels between 60 and 100, his blood glucose between 60 and 100. So we'll give him the right amount of insulin to get it lowered.
Gotcha. So what vital signs must be monitored?
Well, vital signs, they're all very important. But if he becomes hypoglycemic, we're going to want to watch his heart rate because the heart rate will increase. And of course, we want to monitor his blood glucose.
Okay, so what physiological parameters should be monitored when the medication is being administered?
So when it's being administered, we want to make sure that there's no irritation at the injection site, also that he doesn't get any rashes or anything consistent with the anaphylactic reaction.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting or at home?
So they're going to be the same, essentially. At the hospital, we're going to have a better, tighter control over it, but we want to make sure that he eats at regular intervals, that if and when he exercises, that he brings a snack with him, that he exercises an hour after his meals, that he's checking his blood glucose, and that he knows the signs for hypoglycemia and hyperglycemia. If he drinks alcohol, to not drink too much, drink in moderation. And then also we want to, when he is administering it, we want to make sure that he administers the insulin and rotates the injection sites weekly.
Okay, so what are the side effects and potential adverse reactions?
Okay, so the big side effect, we're trying to bring the blood sugar down, so the big side effect would be hypoglycemia. In addition, insulin is going to increase the uptake of the cells of potassium, so we want to look out for hypokalemia, so levels below 3.5, and of course anaphylactic allergic reaction, but he's been on the medication for a while and hasn't had any symptoms.
Okay, so how will you know the medication's effective?
We will know the medication is effective if his blood glucose goes down.
Okay, awesome. Thank you.
All right, you ready to head in there?
Yes.
Okay. Knock, knock, knock.
Come in.
Hello, Mr. Kind. How are you?
Great.
Good. We are going to. I'm Shelby, and this is my student nurse Bree,
Hello.
and we are going to administer your regular insulin today.
Sounds good.
Okay. Can I get your name and date of birth?
I'm Ryder Kind. I'm 67 years old.
Okay, you are. And do you have any allergies?
Nope.
Okay. So do you have any questions about the insulin?
No.
Okay. It says you were last given it in your abdomen, so we'll stay within that region, just a little bit different of a spot for a week until we rotate the injection site. Let's see. Okay, one more time, name and date of birth.
Ryder Kind, 67 years old.
Yes, you are. Okay, and we're just going to check the medication with the MAR, insulin regular. Okay, so it has you on a sliding scale, so your last blood glucose was 290, so that means that we're going to give you 16 units of the insulin.
Hey, whatever, baby.
All right, sounds good. Okay, time. Yeah, we'll do this. Okay, and again, one last time before I draw this baby up. Your name and date of birth?
Ryder Kind. No, I'm 67.
Good. Okay, the expiration date on this is good, so we're good to go. When you're at home, make sure that you are monitoring the expiration date as well. Okay, so this insulin has a peak time of 2 to 5 hours, so we're going to be back in between that time to monitor your blood glucose. Make sure your blood glucose hasn't dropped too far. Do you know the signs of hypoglycemia, low blood sugar?
I do.
Okay, yeah, so if you notice any behavioral changes, you get a headache, cool, clammy skin, you just want to let us know.
I know.
Okay, 16 units of air. So we're just going to put the air in, draw it out. And Mr. Kind, do we want bubbles with our insulin?
No bubbles.
No bubbles. Flick those out. Okay. Gotta get my cap for my one scoop method. Ah. Oh, it's the wrong way. Okay. We are good. All right, so we'll get your abdomen prepared. Now, it says that your blood glucose has been within the 300s lately, and you haven't really been sticking to your diet that well. So when I'm done with this, we'll talk more about a diabetic diet that you'll hopefully enjoy.
Okay.
Whew, close one.
So can I eat pizza?
Well, everything in moderation. Pizza's going to kind of take up a bunch of your calories, so you would essentially kind of be eating less. So I would maybe stay away from greasy, fatty foods. You also don't want a high protein diet either, but you just kind of want to do everything in moderation.
Ouch.
Okay. All right, so your diabetic diet. So you want to, so the 1800 calorie diet is, that's good. So you want to keep your saturated fats below 7%. You're on simvastatin, so this will also kind of go hand in hand with that, with lowering your cholesterol and your lipid levels. You also want to not do a high protein diet. I would stay between 50 and 60 grams per meal per day of carbohydrates, and fiber intake would be fiber and protein should be the same as a non-diabetic. So for fiber, about 25 to 30 grams per day. So here's some information on your diabetic diet. Okay, so you can read up on that when you're not napping.
That's great.
Let's see. I think we're good here. I'm gonna document outside the room, give you some peace and quiet so you can get on with your reading material. Any questions?
Nope.
Okay, is there anything else I can do for you?
Nope.
Okay, before I leave, I'm just gonna lower your bed a little bit so you don't fall out. And how's that heel feeling?
Painful.
Painful, but it's at a 1 still, right?
Yeah.
Okay. If it gets above a 1, let us know and we can give you your morphine sulfate. Okay?
Okay.
Do you have any questions, student nurse, for the patient?
Oh, no, thank you. Just thank you for letting me watch.
No.
You're welcome.
So I do have a few questions.
Okay.
Were there any pertinent pieces of information that you reviewed before administering the medication?
Well, I double checked the blood glucose. That was at 290, and I checked the potassium again. It was 3.8. Or potassium. So yeah, 3.8. So we were good.
Okay. So did the information affect your decision to administer the medication?
No, the high glucose just further insisted, or further required me to apply the insulin,
Okay.
administer.
Did the information affect how you administer the medication?
No, regular insulin can be given IV, but the doctor's order are sub-Q. So I stuck with the sub-Q method and administered the regular insulin. So we just are going to want to come back in about 2 to 5 hours when the medicine peaks, which it's going to be basically at its highest level. So that would probably mean that the blood glucose would drop the most in that time.
Okay. Well, thank you so much, Shelby.
You're welcome.